I live in Canada and a while back I had my appendix burst. As a result they had to remove it. I was in no way stressed out over the costs of the surgery and could focus on my own health. One story that really stuck with me was once I went hiking in the mountains in Norway. On the way we met this woman and her friends from the USA. We hit it off and decided to walk together. At one point the woman fell and obviously broke her leg. Like bad. We got her to a nearby lodge and the paramedics started doing what they could. They said that in order to get her down from the mountain into a hospital they were going to get her a helicopter. She refused and even started crying, saying how she couldn't afford it and was going to walk down herself. The medics got really confused and one of them managed to calm her down. "What are you talking about? Of course you're not going to pay for it." Quote, "This woman was going to climb down a mountain on a broken leg if that helicopter ride hadn't been free. And that is why I'm so thankful that I'm from Norway, where I have never even had to think about that stuff. How much it costs would never even cross my mind if I were in her shoes. I have always had access to universal health care. I think it all comes down to mentality. I would always choose to pay more in taxes to ensure universal health care, free education, etc. Always, because I know that even if I will never need to reap the benefits, someone out there would be crushed without it. Because without universal health care people will die. 4/5 of my grandparents, grandmom remarried, have or died from illness. Without universal health care I know that they would not be able to get the treatment they needed. And the rest of their lives would be so much worse for all of them. And that is not something I want for anyone. In order for a society to succeed you have to treat everyone the same as you would your own family. And sometimes that means making sacrifices, such as taxes, for the betterment of society. My mother had multiple lifelong health issues and had her life significantly extended with an ICD unit and over 15 different medications that my family could never have afforded. Having inherited her chronic kidney disease, I have been offered tolvaptan medication to mitigate the decline in my kidney function. For context, tolvaptan costs £15,750, estimated, per year for one person. I'm eligible to have it at an annual cost of £36. I have no private medical insurance. UK NHS is Brill. I had stage 4 cervical cancer. Put on a clinical trial. 12 cycles of chemo. 30 radiotherapy session. 3 brachytherapy. Follow-up appointments for 5 years. Free prescriptions for anything for 5 years. Even gave me a pass for free parking at the hospital throughout my treatment. All tea, coffee, etc. free. Even fed you if you were there more than 4 hours. Well, I live in the Netherlands and my mom was diagnosed with lung cancer. She had a tumor the size of a tennis ball in her right lung. As soon as it was found out, they immediately started treatment in the hospital where she shared a room with 3 other people. At first they were skeptical she would survive, so she was put on a quite tough treatment. Stronger chemo, etc. She lost all her hair but she could get a wig basically for free. She didn't took it though, as she found them really itchy. The doctors and nurses were very considerate. And even though she didn't had a room of her own, she did have like a mini desk with flat screen TV and all, and the food was quite decent. Eventually she made a full recovery and the doctors told her the tumor was gone and that it had surprised them as well. After that she had to be examined like every 3 months to make sure she still was cancer-free. Eventually it came back and she was immediately put into treatment again and eventually was cancer-free again. This all was over 4 years ago and she still is being checked regularly. After a while they cut it down from every 3 months to every 6 months. She still has some issues due to the chemotherapy and radiotherapy. Her eyesight had been greatly reduced, for instance, and is still being treated for that. She even got placed in a pool of people that would be the first to receive some sort of new injections that could fix this. She is receiving these shots for the last couple of weeks now, and she is able to read the subtitles again on the TV. All in all, I am extremely happy with our healthcare system. It practically saved my monsieur. I'm from a family that had quite some financial troubles, so we would never be able to afford top-tier insurance. Edit. About the financial aspect, which I forgot to mention. Sorry lol. It's true that it's not entirely free, so it technically doesn't qualify as UHC, and although it's true you do have to pay for medical bills etc., it's never more than 350-ish per year. I pay €120 each month for my insurance, which is mandatory by law, but get €97 subsidized for that. But it does depend heavily on your income. If you earn a lot, you will not receive said benefits. Both parents have had cancer. Both survived. Neither went into debt. Neither even paid a cent. Pretty good. I live in Germany. I'm very thankful for it being mostly free and living in an area where every kind of care you need is available. I consider that it's quite luxurious. The quality is going downhill though, due to the lack of professionals, partially relatively low wages and an insane bureaucracy. UK resident here, the NHS is not perfect, as any large massive organization isn't, and there is not enough money in the universe to treat everyone for everything, or treat people as quickly as might be possible. If I get ill, I will be made better. If I darnage myself, I'll be fixed, no matter how stupid the injury or how drunk I was. As a kid, I had all the vaccinations. Eyesight, hearing, dental checkups regular as clockwork. If I'm going on holiday to the jungle, I get the jabs I need. Anywhere, anytime, 24/7. I can dial 999 and an ambulance will turn up and help me, and no one mentions money. Ever, and #X200B. Only real downside is casualty. https://www.bbc.co.uk/programs/B006M8WD is a terrible soap opera and really low rent compared to the US series. But Green Wing, en.wikipedia.org/wiki/green_wing, was awesome. So swings and roundabouts. Canadian here. It's a relief not having to worry about healthcare. Aside from dental and vision care, that is. We pay for those. I can't imagine worrying about having to pay for doctor's visits or emergency trips to the hospital. Sure, sometimes you sit and wait for 3 to 4 hours to be seen in hospital, but I'd trade that time over paying hundreds or thousands. The greatest part is that if it's a true emergency, you will be seen and taken care of right away. People who are less ill will wait. But I honestly think that's a pretty good way to do things. As a person who's had different health issues over the last 5 years which have required a lot of doctor's visits and minor surgical procedures, I am extremely grateful for universal health care in Canada. Great! There's waiting lists for some things, but quite a lot are fast and convenient. I can call up to see the GP and get an appointment within a week. I can book it through an app if I want to instead. Same with ordering more medication, etc. Seeing a doctor is free. Getting a blood test is free. Prescriptions are free. The biggest problem is the NHS doesn't get enough funding. They do wonderful things with what they have, but they could be even better and less overworked with more resources. My wife is taking 6 different medications every day, as one of them is a long-term condition. The cost per month is £0. I used to live in the US, and now I live in the UK, so I have literally had the exact same surgery in both countries. In the US, I was scheduled for surgery a month or so after I was diagnosed with a probably benign tumor. I had open surgery and spent 4 days in the hospital in a private room because I had good insurance. Just after the surgery, though, I was told that my insurance had lapsed due to a late payment. which wasn't even true, and I had to spend weeks of my recovery time stressed out and on the phone with the insurance company. A few years later, the benign tumor came back and I was living in the UK. I was put on the waiting list because it was known to be benign. I only had to wait a couple months. Honestly, not much longer than I waited in the US. And I was given keyhole surgery and spent one night on a ward with 3 other women. It wasn't comfortable, but it was definitely adequate, and the nurses and doctors were all kind and attentive. Did I really need to have open surgery and a 4-day hospital stay in the US? Or was that prescribed only because I had the insurance to pay for it? I'll never know. But my recovery in the UK was much less stressful and I never had to worry about paying for it. Even though I was unemployed at the time, the healthcare system here is not without problems: bloated management, underfunding, and all the usual things you get in every system here. But from the patient level, I can tell you I will probably never go back to the US just because of the healthcare. I can always get in to see a GP when I need to. I live in Scotland, so even my prescriptions are free. I don't mind paying my taxes here because I know I will reap some benefit from the taxes I pay. Canadian here, who lived in the USA for 2 years, so I've experienced both systems. I've had a history of kidney stone problems much of my adult life, so I have gone through some scenarios in both. I did find that seeing a specialist for a relatively non-urgent condition was much faster in the US than Canada. Seeing a urologist took only a few days, whereas here it was going to be weeks. Having surgery in the US, it seemed like they were able to accommodate my schedule, rather than here in Canada where you take the next available slot, and there can be definitely wait times. Having said that, I think that the universal healthcare model is vastly superior. I've been in about a half dozen times in the past month due to kidney stone pain, including an emergency surgery as well as a 2-night stay in hospital when they decided that was the only realistic way to manage the pain. No bills, no paperwork, and each visit I saw an excellent physician within no more than 3 hours wait. I had a good plan in the US, but we still paid what I consider to be a fairly significant amount on healthcare because of copays and deductibles. In addition to the monthly cost deducted from my paycheck, the amount of paperwork was unbelievable. I filled an entire banker's box with documentation in a 2-year period. The complexity of dealing with out-of-network providers. If you go to a hospital not affiliated with your insurance program, or even have a surgery at an in-network hospital but they use an out-of-network anesthesiologist, you pay more or even don't have coverage. Was a huge pain in the ass. In a universal healthcare system like Canada, there is none of that. You see the physician you need to see, go to the facility you need to go to. It's all under the single healthcare system. Here virtually no paperwork other than filling in medical history forms at a new provider. No financial paperwork at all. The other thing that really bothered me was the inequality of the system in the US, the fact that not everyone had a good or any health plan, and that there are so many cases of people having to literally choose between being healthy or out of pain, or even beating a fatal disease like cancer, with putting food on the family's table or roof over their head. I was on the good side of the system since I had a good job and a good plan, but it still seemed unfair to me. I also realized that if I lost my job, especially for a long time, if there was an economic downturn, that this could have a serious impact on both my and my family's physical health. The system certainly has its faults, but overall the quality of healthcare is still very good. And to me, the universality of it is common sense. I also recognize that as a political viewpoint that everyone is entitled to healthcare. It still bewilders me that a country as advanced and as wealthy as the US considers the private healthcare system to be superior. British here, I was born in an NHS hospital, which cost my parents about £10 for parking. I've had a broken leg fixed, some x-rays done on other bones, and my appendix removed. All for free and all with no waiting. My mum recently had a cancer scare and saw a specialist within 5 working days. Results back within 48 hours. Not cancer, but required a minor op, which was done a fortnight later. Bit annoying to wait that long, as she couldn't eat properly, but soups and smoothies worked okay, so there was no risk. She was out the same day and back at work later that week. My friend had a doctor's appointment and was 150 miles away, having a brain tumor removed the next day. He was offered same-day surgery, but declined as he wanted to see his children beforehand. He received a great deal of treatment over 4 years, including another op, chemo and drugs. He spent 2 months in hospice and end-of-life care, which was brilliant and kept him comfortable. His family paid parking charges throughout this, but didn't have to worry about anything else beyond coping with their loss. His children still have a house to live in. Is all good. Stretched but good. Sometimes I have to wait 48 hours to see a doctor, and there was a waiting list for physiotherapy, so I paid privately for that. American here who just had my first NHS experience. I injured my back, and after days of waiting it out, finally made a late-night appointment with a doctor on call in my local hospital. Getting the appointment was a bit of a pain in the butt. They asked a lot of questions over the phone before agreeing to see me, because the healthcare system is underfunded and the hospitals in NE have long wait times. But once they agreed, they gave me an appointment within 3 hours. I walked in, saw a doctor, got medication and walked out. The 2 people at reception actually laughed when I tried to pay. I did the math later, and the same last-minute appointment and tablets in my home state would have cost almost $400. The NHS is fantastic. I know that no matter what happens to me, I will never be hundreds of thousands of pounds in debt. I don't have to think about how I'm going to afford medical care if I crash my car, if I break my leg, if I get sick. Although, when I was 12, I had my tonsils removed. It got infected really badly and I was bleeding so profusely from my throat that I was unable to properly breathe. I was in the A&E waiting room for 8.5 hours Saturday night, only to be told to keep swallowing and take antibiotics because cauterizing it was too time consuming and they would only do it if I was turning blue, etc. The resources are stretched so thinly, and the staff are underpaid massive amounts but I could not imagine living in America, where the only thing scarier than cancer is paying for it, under pressure due to austerity. But amazing, staffed by amazing people, all trying their best. When I see an ambulance racing by, I can think someone is having a garbage day because they need an ambulance, not because they're now maybe gonna lose their house. In places with universal health care, the main problem with being sick is being sick, and that's how I feel it should be in a civilized society. I think the biggest misconception with universal health coverage is that it eliminates the so-called choice of a medical insurance system. The reality is there is choice in the UK, with roughly 11% of the UK population having some form of private medical insurance. In Harley Street, https en.wikipedia.org/wiki/Harley_Street is one of the most prestigious private medical districts in the world. Some of the largest providers include Bupa, https://www.bupa.co.uk/AXAPPP, https://www.axaphealthcare.co.uk/Vitality, https://www.vitality.co.uk/and Aviva, https://www.aviva.co.uk/. Although the NHS provides free care at the point of need, Private medical insurance may benefit those who need non-critical care and want to be seen more quickly and conveniently, and in hospitals with more luxurious conditions. The private and public sectors share the same pool of qualified medical practitioners. However, few consultants work entirely in the private sector, so you aren't guaranteed better care by going private. I have been lucky enough to be offered private medical insurance by my employer in the past, but chose to receive the cash equivalent instead, as I feel the NHS treatment is so good I don't need it. My experiences probably mirror those of most UK parents. All 3 kids are now grown up, but there would be at least one visit to accident and emergency per year. If triage said it wasn't urgent, queue a wait of up to 8 hours. But kid would be seen and treated. Concussion, broken limbs, appendicitis, all treated ASAP. No quibbles. X-ray, scans, tests, all fast-tracked if the ailment was considered possibly serious. The only cost we ever worry about is the rip-off fee for the hospital car park. The NHS is Britain's greatest institution. It's flawed, but it's there. My daughter was born a year ago. I was completely ripped off, had to pay $30 for overnight parking. Canadian here. In 2012, a nurse noticed a mole on my arm looked weird, referred to a dermatologist, and had a biopsy that confirmed melanoma. Got the call 1 to 2 weeks after the biopsy and had immediately had a surgery appointment booked. A couple days later, had my cancer removed, and an incidental painful cyst done at the same time, because the surgeon was there anyways, and histo confirmed that it was fully removed, so I'm cured. Whole thing cost me about $20 in taxi fare because I didn't have a car. I now get semi-annual derm checks for free to make sure I don't get it again. I've had many other minor illnesses, pneumonia, injuries, infections, bronchitis, ruptured eardrum, testing and consultation for a genetic blood clotting disorder, etc. I've just recently had a 2-day heart monitor to check for a possible arrhythmia, and have an overnight sleep study booked to look at my insomnia. All covered. I have luckily never had to be hospitalized, so cannot comment on that part of our system. But I've never paid more than parking for hospital visits. Drug coverage is different here. I have a drug plan, so generally only pay 30% of cost before that. I did have to spend about $80 on antiviral medication for shingles, which sucked. My dad has heart disease. A few years ago he had a very scary episode and spent a couple nights in the hospital, but now has excellent doctors doing a great job keeping him asymptomatic. All covered, so yes, I love our healthcare. It's not perfect, but if we lived somewhere like the USA, everything that has happened to my family could have crippled us financially. I cannot imagine living in a country that punishes its citizens for being sick. So fluff Doug Ford in his plan to hurt OHIP. Bloody amazing. There's so much to stress over in life. It's nice to know that if I or a family member gets sick or injured, we don't have to worry about a bill at the end of it. I am happy to pay higher taxes for this peace of mind. It's priceless. Edit. Misspelled a word. Got diagnosed with testicular cancer. The next day I am at the hospital seeing a specialist doctor who is setting up a plan for treatment. Within the next 3 weeks, I get X-ray, magnetic resonance scans and the final operation to remove the cancer. Stayed overnight at hospital. Went back home the next morning. I have annual checkup to see if cancer doesn't pop back for a visit. Had paid leave for 2 weeks after the operation. Total cost $0. Do I pay my taxes? Hell yeah. Between death and taxes, I'll take taxes. I almost died from an overdose, so I got brought in and they fixed me and sent me on my way. It was unbelievably easy. That experience also scared me straight, and I've been clean since then. Hooray. I'm in the Air Force and we all have TRICARE. DoD is essentially the largest socialist workplace in the US. It's a nightmare sometimes, but only because of the inconveniences. I say that in a spoiled way BC I would rather deal with that than not have healthcare at all. Our PCMs, primary care manager, assigned doc, are hit or miss. Some will just give you ibuprofen and some will try and help you fix the issue. Getting a referral to see chiropractors and whatnot sometimes takes a minute, but usually it'll go through. I grew up always sick. I always had swollen tonsils like 4x a year. When I was in my mid-20s I got strep for the last time and asked to get my tonsils removed. And doctor felt an abnormal sized lymph node and was concerned I had lymphoma. I had my tonsils removed and my lymph node taken out and biopsied. It was benign, but I'm glad he was that concerned. TBH. Haven't been sick besides a minor cold, allergies since. People hate on our healthcare, but it's so nice to have it for free and never have to worry about paying any upfront costs. If the military can do it, the rest of the US can. I would be dead without it. I am on my 4th ICD, sort of like a pacemaker. I can tell you, the surgeries and care that went into that surgery and for it to happen 4 times over. There is no way I would have been able to pay for it. Even if I had private insurance, the premium would be unreachable. My cousin has had 2 kidney transplants on. When she gets sick, she has to be medevac to a hospital. That takes 3 hours to fly to for intensive care for 2 weeks, 2 months. Her family would never have afforded that, even with all our help. UK. Healthcare is first class. The only real catch is you have to wait ages for anything. Took me 4 months to see a specialist, for example, which would probably only be a week or 2. Privately, however, it was entirely free. There is a charge for drugs in England. Any drug costs a max of £9, $11.86, regardless of what it is. That's free if you're unemployed. The NHS is one of the best things. Let's just put it like this. Without universal healthcare, half my family would be dead, and the rest of us would probably be completely broke. I live in Poland and the healthcare is disputable. Of course, we don't have to pay for stuff like visit in public hospitals, surgeries or visits at the doctors, and I really appreciate it. I heard so many horror stories from the US, for example. We also can get financial help when getting braces and such. Vaccines are also free, the most important ones. Until you're 18 years old, almost every year there's a vaccine you need to have. But waiting in lines is a nightmare. And you can wait for, let's say, 10 years for a surgery because there is high demand and hospitals are tragically understaffed. When you want a really good service, you go to a private doctor, surgeon, because you don't have to wait and usually they do their job better. But if you're not so well off, you still got an option, which is a relief for the most of Poles. The NHS gave me life-saving open-heart surgery when I was a baby, and the Ronald McDonald Foundation allowed my parents to stay for free in an apartment next to the hospital for the duration of my surgery and recovery. I will have a heart condition for the rest of my life, but the NHS got my back. Less than 3. I have been lucky enough not to have any serious physical health issues, but I've been in the mental health system since I was 9, so this comment is about that. Australian psychiatric care has a long way to go. When I was 15, I went to the ED because I was extremely suicidal. They sent me home with a sheet of 25 milligrams Seroquel because there were no beds in the psych ward. I was on 900 milligrams of Seroquel a day at that stage and ended up attempting a week later. If you don't have private health insurance and you're mentally ill, then you're pretty much fluffed. If you're acutely mentally ill and under 16, you're also fluffed since no private hospitals will take you. Even then, those places are a revolving door. I had 9 admissions in private hospitals and the same people are always in there, me included. I haven't been inpatient for nearly 2 years now, though. Private hospitals offer a lot more therapy than public psych wards. The public system is there to keep you safe, aka sedated, and will just keep increasing sedatives, often off-label. Psychiatry is covered by Medicare for the most part, but with psychology, therapy, which has done way more for me than what meds have, you have to pay out of pocket for. Going at an average of $150 an appointment, it gets old real quick.